Hey guys, this is Thomas from NurseMoneyTalk. And in this video, I'm gonna talk about dosage calc. Yes, that's right, dosage calc. What appears to be the pain of most nursing students, and oddly enough, makes a lot of nursing students think that you need like a 4-year mathematics degree in order to be a nurse. So this is going to be a first of a multi-series video that I'm going to do over dosage calc. But in this first one, what I'm going to do is talk about what exactly it is, and also like how nurses, if at all, use it in kind of like regular practice. But before I get to that though, I want to go ahead and invite you to hit that subscribe button if you are not already subscribed. If you find this video helpful, would definitely appreciate the thumbs up. And as a last note, make sure you stay till the end, because I'm going to share with you a resource that you can use to, like, if you're about to take dosage calc or you're in dosage calc and you're struggling in it, that you can use to kind of hopefully get better in dosage calc. Let's go ahead and get started though. What exactly is dosage calc? So dosage calculations, or class as far as nursing students is concerned, is really just a class that's going to teach you about calculating medications that nurses are then going to give to patients based on whatever order that the physician or whoever the provider gave. And that really is what it is in a nutshell. It is about making sure that based on the order that the patient gets the correct dosage. Now, the next thing you might be wondering is, do nurses actually use dosage calc on the job? Is there any like real practical usage of this? Doesn't pharmacy like pretty much send the right medication to you that you actually need without you having to really do any weird calculations? So the answer to this is really all over the place, because it really does depend. Now, let me tackle with the first part, which is like, do nurses even use dosage calc? Is there even like any practical usage to this? And the answer to this is yes, there is, absolutely. You see, believe it or not, you use dosage calculations, or the concept, the topic, the skills on an almost regular basis if you're working with direct patient care nursing, because as nurses, we give a lot of medications. Like, I've worked some jobs where in one shift, like, I kid you not, I've probably given out more medications than the average person will give in their entire lifetime. And I'm thinking of I don't even know, like, it's just kind of crazy, like, how much medication, especially if you're working like a med-surg floor or like a big unit or floor where you have a lot of patients. But the point is, we give a lot of medications, and those medications are not always cookie cutter, just kind of like exactly what we need. So I think when people think of dosage calc, they're typically thinking of like the very complex versions of that. And there is definitely a time and place for that. But even on the simpler side, so like, you get an order for medication A, this patient needs to get medication A, 10 milligrams PO by mouth, right? And so the medication A comes in a 10 milligram tablet. You're gonna give 10 milligrams, 10 milligrams. Well, what if instead of 10 milligrams, that tablet comes in 20 milligrams? Then what are you gonna do? You're gonna break it in half. It's a very simple and basic version of it, but that is also dosage calculation. Now, the other, extreme end to that, not really extreme, but the more complicated version of that is like if you get like an order to give, some medication where you have to take the patient's weight into account along with the concentration of the medications. And so all of those things then makes it more complicated. But those are all important in terms of making sure that the patient gets the right dosage. Now, one thing that I have seen kind of come up is like, well, doesn't pharmacy just send you the right medications that, or not the right medication, but kind of like the right dosage? And, doesn't the facility, just have the right dosage that you need? Well, here's a couple things with that. As for the pharmacy end, I will say this, I have worked at a facility, I'm thinking one in particular, where for a lot of the medications, pharmacy did literally cut the pill in half and then send it to you like pre-packaged and then for you to scan it. So there are facilities like that, but I'm not sure that's a lot of facilities. Because that's only been one that I've worked in. Everywhere else, like you're pretty much like you're probably gonna have to cut that pill in half. Like if it's if it comes in a 20 milligram and you need a 10 milligram, then pharmacy's not gonna pre-cut it typically. It's gonna be in the omnicell. You're gonna have to take it, you're gonna have to cut it in half, and then especially if it's controlled, then you have to waste it through the omnicell. But the other thing with that is when you're looking at, well, doesn't the facility just buy what you need? No, not really. Like, because the thing is like when you're looking at for medications or dosages of a medication that a patient gets, sometimes like it can be like significantly different from one patient to the other based on anything from like the patient conditions to what's the actual diagnosis to like, maybe body weight. Body weight might be a big factor for how much or how little a patient will get of a medication. And so, you could have a medication where maybe the manufacturer does produce it in several different dosages, but that doesn't mean your facility is going to buy all those different dosages. They'll probably buy the most common uses and then they'll just kind of expect it to be cut or whatever. To be able to get the right, for you then to be able to give the patient the right dosage. So I wouldn't rely on that either. I think in general, like dosage calc is a very important skill that nurses need to master. It's one that a lot of nursing students struggle in because I do understand that there is math involved. The math tends to not be a lot of people's strong suit. I mean, it seems like to me that you either like math or you hate it. Like I seldom ever really see somebody who's sitting right in between. But I would encourage you to really focus on that, and even as much as you might hate it, to try to get at least an adequate understanding of dosage, of calculating like med dosages, because it is very, very important. If you are struggling with dosage calc, you're in the class, you're thinking about taking, you're going to have to either take the class or it's going to be like part of your kind of sprinkled throughout your nursing program, depending on how your particular program handles the class, or handles the topic, I should say. And you're going to need help. Couple options as well that I'm going to give to you would be look for a tutor. So NurseMoneyTalk.com/tutor. You can also look for like this online resource as well. And you can get to that by going to NurseMoneyTalk.com/student academy. So definitely check either one of those two links out. Now, I think I will make another video. Like the next one I think will be on just kind of touching a little bit more on the the dosage calc class and how hard that is, and kind of talking a little bit more on the specific class itself. So Definitely check that out. I'll release that in one of these videos that you'll see that'll show up as soon as that's ready. And if you're not subscribed, make sure you are subscribed and that you hit that notification bell so you don't miss when that video comes out. Thank you so much for watching this video, and I'll catch you very soon in that next one.